This podcast is brought to you by Progressive Insurance. You chose to hit play on this podcast today. Smart choice. Progressive loves to help people make smart choices. That's why they offer a tool called Auto Quote Explorer that allows you to compare your Progressive car insurance quote with rates from other companies. So you save time on the research and can enjoy savings when you choose the best rate for you. Give it a try after this episode at Progressive.com. Progressive Casualty Insurance Company and Affiliates. Not available in all states or situations. Prices vary based on how you buy.
This episode is brought to you by LifeLock. The holidays mean more travel, more shopping, more time online, and more personal info in places that could expose you to identity theft. That's why LifeLock monitors millions of data points every second. If your identity is stolen, their US-based restoration specialist will fix it, guaranteed or your money back. Get more holiday fun and less holiday worry with LifeLock. Save up to 40% your first year. Visit LifeLock.com/podcast. Terms apply.
Around lunchtime yesterday, the news broke. There was an arrest in a case that has dominated my timeline for the last week.
Hi, I'm Diane Macedo. We are coming on the air because multiple law enforcement officials say a person of interest is now being questioned in the New York City murder of UnitedHealthcare CEO Brian Thompson. They say he's identified as 26-year-old Louise Mangione.
It was Wednesday when this shooting took place, right in Midtown Manhattan, just before dawn. It made an anonymous healthcare CEO into a sudden household name.
Brian Thompson was killed Wednesday morning as he walked alone to the New York Hilton Midtown Hotel, where the health insurer was holding its annual investor conference.
At 6:48 a.m., officers arrive and find the victim, Brian R. Thompson, a 50-year-old male, on the sidewalk in front of the Hilton with gunshot wounds to his back and leg.
Fueled by surveillance video showing the shooter speeding off on an e-bike, just about everyone had a theory about what had gone down. And those without theories had jokes. There were jokes about how being a CEO is a pre-existing condition. Jokes about whether Brian Thompson's ambulance ride would be considered out of network or not.
The murder has sparked shock, but also a cascade of vitriolic comments online towards insurers about the high costs of health care, many with a blatant lack of sympathy towards the murder victim.
The grim satisfaction some seem to feel at this murder, even before the arrest of a suspect, it seemed worth talking about. I mean, the online reaction to Thompson's death was so quick and gleeful, I guess. Did that surprise you?
I wasn't surprised. I think my initial instinct with UnitedHealthcare has been this is a company that has a lot of enemies, and in many cases for good reason.
Dan Diamond has been covering this CEO murder for the Washington Post. He reports on the American healthcare system. And in a weird coincidence, he actually went to the same high school and college as the shooting suspect, though not at the same time. As of this recording, there are early indications that Brian Thompson's murder had something to do with his job as an insurance CEO. The alleged killer was carrying a manifesto, some have reported. But I'm not sure how much the shooter's true motivation matters, because it was so clear from jump how the American public was making sense of what happened. Dan Diamond, he talks to people caught up in the Kafkaesque world of medical insurance every day.
There are polls that show most people like their coverage, but you could still go through many Americans' interviews on health insurance, and without fail, people have been turned away at times. They've been hit with surprise bills. They've tried to get procedures done that their physicians wanted, and the insurance company came back with a reason why that couldn't happen. I've accumulated lots of those stories over the years, and it's not always about UnitedHealthcare, but UnitedHealthcare, as the biggest health insurance company in America, gets more of those stories than any other. And the fact that it has grown so rapidly into other parts of our health system through this United Health group means that the company is making new enemies all the time.
Today on the show, making sense of a murder that seems to have had a message the American public grasped immediately. I'm Mary Harris. You're listening to What Next? Stick around.
This episode is brought to you by NRDC. We all know by now that Trump was elected president, and one thing is paramount. We must fight for our planet. The Natural Resources Defense Council, NRDC, is fighting in and out of court to protect the environment, public health, and climate progress from Trump's Project 2025 agenda. NRDC has done it before, and with your help, they'll do it again. During Trump's first term, NRDC filed over 150 lawsuits against Trump's administration and won almost 90% of resolved cases. And this time, they're ready to fight even harder. Despite Trump and his allies' best efforts to pull society backward again, NRDC will work every day to not let them stand in the way of progress. Your support is critical right now. NRDC is not giving up, and with you, they can safeguard our planet for future generations. Donate now at nrdc.org/podcast. All gifts matched for a limited time.
This episode is brought to you by Discover. It's always nice to get more for less. So here's a life hack that can automatically put some extra cash in your pocket. Discover will automatically double all the cash back you've earned on your credit card at the end of your first year with Cashback Match. So you could get some money for this holiday season and get more next holiday season. It pays to Discover. See terms at discover.com/creditcard. Can you and I talk about UnitedHealthcare as a company and why, to some people, it may have seemed like an ideal villain almost when this shooting took place? Like, you've covered them for many years. I know they're huge. Give me your take here on how they found themselves in this situation.
UnitedHealthcare is about 50 years old. It started in Minnesota, is still headquartered there, and has steadily grown over the past decades to now cover about 50 million Americans' health coverage. Some of that is through Medicare, the spinoff of the Medicare program called Medicare Advantage, where private health insurers can provide the coverage. Some is through Medicaid managed care. A lot is through employer insurance. So you might have a plan through your company, and UnitedHealthcare is the one administering that. As a result, there are people who started to have negative experiences with UnitedHealthcare. There's evidence that in their Medicare business, for instance, they've been pretty aggressive at denying care to people who might have needed follow-up services. They got out of the hospital after surgery, an older patient who had a fall and needed to spend weeks going through post-acute care, and UnitedHealthcare turning down that care that was requested by physicians. There are stories like that all the time in healthcare, Mary, but I think so many have congealed around UnitedHealthcare because so many Americans are now covered by it.
Yeah. I mean, you can just tick off the things people have to complain about. A lot of people have focused in on prior authorization for certain kinds of treatment. The fact that your doctor basically has to write a "Mother, may I" note to the insurer before you get a big scan or a big treatment. Is that something that UnitedHealthcare does more than other people, or is it just that they're more visible?
I think the answer is both. There's evidence that UnitedHealthcare denies claims at a higher rate, requires more of these prior authorizations than some other plans. But again, because they have so much tonnage, they have so many millions of Americans enrolled, that's another reason why stories have piled up against them.
They use AI to process claims too, right? It's just sort of like this banding together of things that have a vaguely nefarious vibe. You know what I mean?
Stat News did a great series on United Health and how a company they acquired, NaviHealth, has used that algorithm to increasingly deny care in cases where patients said that they needed it.
And at the end of the day, UnitedHealthcare is doing really well financially, right? Like, can you just put some numbers behind that? How well are they doing?
Well, United Health Group, which is the parent company, is on the scale of about $400 billion in annual revenue.
Whoa.
Yeah. I mean, and to put that in context, that is the fourth largest company in America. This is a company that has holdings in home health, in obstetrics, in claims processing. I went through earlier this year and looked at all the subsidiaries that United Health Group has. It's 2,200 different smaller companies. This is just a company where the tentacles have spread across the system. Increasingly, Mary, we don't have a U.S. health system. We have a health system that is being run by UnitedHealth in all of these different ways. Some of this spilled out with a crisis earlier this year when doctors and hospitals couldn't get paid. That's because one element of UnitedHealth Group that processed these bills across the country had been hacked. And because UnitedHealth got hacked, essentially the U.S. health system got hacked. We have outsourced so much of the work of healthcare to this one company and its subsidiaries.
Huh. I mean, you were actually at a hearing about this cyber hacking moment, and you've been thinking about that hearing a lot, I know, in the last week or so as you process all the vitriol online. Tell me about that hearing and why you've been mulling it over again now.
This was back in May after UnitedHealth, its subsidiary Change Healthcare, had been hacked.
Subcommittee on Oversight and Investigations will now come to order. The chair recognizes himself for a 5-minute opening statement.
Doctors and hospitals weren't getting paid. This became a major crisis in the U.S. health system.
How did consolidation in the health insurance industry reach such a state that a single ransomware attack on one company can cripple the flow of payments and claims for months?
I think patients were mostly insulated from this, Mary. Part of that was because there was a major effort to rush emergency cash to affected providers. But in Congress, it had become an emergency. And they summoned the CEO of UnitedHealth Group, a man named Andrew Whitty, Brian Thompson's boss, to D.C. to testify. The CEO of UnitedHealth Group had not come to Washington in many years, even as his company took on more and more of the U.S. health system. So all of these pent-up frustrations poured out, both from lawmakers and also from patients who tried to pack the hearing rooms and at times confronted Whitty, yelled at him about prior authorization and how that was harming patients.
The patients, I know you got some audio of them. It's funny because they sounded exhausted. And I think they articulated that. They said, like, I'm tired of fighting.
I'm tired of fighting to stay alive, and I'm tired of burying my friends. I'm tired of suffering. Stop.
It was really emotional and not the yelling I would expect. You know what I mean? It wasn't a show. It seemed like an earnest attempt to just display how frustrated these patients were with this company. Did it feel like that to you, who was actually there?
Sort of. And I went and talked to some of the protesters about their individual cases. And according to them, they had needed emergency care, urgent services that UnitedHealthcare was denying at length at times, even as their physicians were urging the insurer to let it happen. So there were people who were just beaten down, worn out. Many of them were organized by this group, People's Action, an advocacy group that is really focused in on UnitedHealthcare and its denials of people's requests.
How did Whitty, the CEO, how did he respond in the moment?
He was mostly shielded by the army of UnitedHealth people with him, did not engage as far as I remember. It was a tough few days for UnitedHealth. They had negotiated around how long Whitty was even going to be testifying. And once he was there, it was kind of like a taking of medicine and getting it over as much as possible. I remember talking to some of the UnitedHealth folks about that they knew it was going to be a painful day, but they just kind of wanted to get it over with. And honestly, Mary, they kind of won. Like there was this 1 or 2 days of coverage. We tried to cover it aggressively at the Post, but that crisis largely passed. And when it came out months later that 100 million Americans had their information compromised as part of this hack, people basically shrugged it off. There was not a public outrage toward UnitedHealthcare.
And then, of course, we get to this past week, and it was like there's like pent-up frustration that was like just looking for an outlet.
That's how I've been thinking about it, too. That if you had asked any American who'd had a difficult experience with a health insurance company over the past number of years, do you feel like these problems are getting fixed? Do you feel like anyone's hearing you on the struggles of getting healthcare in America? A lot of people would have said, this is a big problem. The death of Brian Thompson should not have been the window for all this to pour out. But I have just heard from so many frustrated people that they're looking for answers and haven't heard them on how America is going to fix its health system. The track record shows American healthcare is an outlier in the developed world, and UnitedHealth Group, as the biggest player, is a big part of that.
Yeah. I mean, I think a lot of Americans were used to the line that, like, the market rules everything and making something into a business will make it more efficient. And you look at healthcare and I don't know, there's no way you can believe that, frankly. I don't think.
We have a system that is a historical accident. In World War II, there was a carve-out made that companies could provide health insurance to their employees. It was a way of kind of recruiting people into the workforce and offering benefits. And then after World War II, we made that permanent. So we ended up with this relationship where historically Americans have gotten health coverage through their employer. In other countries, healthcare is just a right. There doesn't have to be this triangulation of depending on your employer to negotiate a plan for you, to offer you benefits, that if you lose your job, you might be without health coverage. So we just have evolved in a very different way. And as you're getting to some of your questions, our prices are much higher. We do have prices that are essentially double in many cases what other countries have. And because of that, it has raised the cost of everything across the system: hospital care, drug prescriptions. And our insurers are the ones that patients tend to interact with the most. So that's where we see the hit on our pocketbooks. And that's one reason why insurers, rather than doctors or hospitals, end up taking much more of the blame, even though insurance companies aren't alone in raising prices.
After the break, how will the healthcare industry respond in this moment of public anger? This episode is brought to you by Discover. It's always nice to get more for less. So here's a life hack that can automatically put some extra cash in your pocket. Discover will automatically double all the cash back you've earned on your credit card at the end of your first year with Cashback Match. So you could get some money for this holiday season and get more next holiday season. It pays to Discover. See terms at discover.com/creditcard.
This episode is brought to you by NRDC. We all know by now that Trump was elected president, and one thing is paramount: we must fight for our planet. The Natural Resources Defense Council, NRDC, is fighting in and out of court to protect the environment, public health, and climate progress from Trump's Project 2025 agenda. NRDC has done it before, and with your help, they'll do it again. During Trump's first term, NRDC filed over 150 lawsuits against Trump's administration and won almost 90% of resolved cases. And this time, they're ready to fight even harder. Despite Trump and his allies' best efforts to pull society backward again, NRDC will work every day to not let them stand in the way of progress. Your support is critical right now. NRDC is not giving up, and with you, they can safeguard our planet for future generations. Donate now at nrdc.org/podcast. All gifts matched for a limited time.
One thing I wanted to talk to Dan Diamond about is how the death of UnitedHealthcare's CEO might prompt insurance companies to change the way they do business. Because there was at least one sign last week that healthcare bigwigs were thinking through some changes. I'm talking about what happened with Anthem Blue Cross Blue Shield. Back in November, they'd announced a policy change saying they weren't going to pay for anesthesia care if surgeries exceeded certain time limits. But after Brian Thompson's murder, the company announced it was halting that policy, which sounds like a win for patients. But Dan Diamond says it's a little more complicated than that.
With the caveat that I have not spoken to Anthem, the insurance company, directly on this, I've only been reading the coverage. It seems like both a understandable confusion and frustration given the weirdness of our system, and also an overreaction about what Anthem was trying to do. The insurance company was not trying to set up a system where if you were in the middle of surgery and you needed anesthesia, the patient wasn't going to get the anesthesia. The insurance company was trying to rein in the payments for what anesthesiologists receive. And what they were asking for was essentially more paperwork and documentation for these anesthesiologists to show that if a procedure went longer than the target time, there was a reason for it. And I'm getting some of this from a Brookings expert named Lauren Adler, who's looked into this. And I thought had a pretty even-handed approach, which is, should insurance companies be abruptly announcing new terms for how physicians are going to get paid outside of whatever negotiation they normally go through? Probably not. Like, this should be something that gets hammered out, and then the insurance companies and the doctors come to an agreement. There shouldn't be this sort of brinksmanship that we often see in healthcare. But was this a deliberate attempt by insurance companies to make sure that patients don't get the coverage that they need? No. Lauren's argument is this actually might have benefited patients because it could have protected them from some of the bills that they've been getting from anesthesiologists.
Yeah. What was interesting to me to watch this story ping around the internet was how people like Senator Chris Murphy from Connecticut or New York's Governor Kathy Hochul sort of seized on this and were like, this is appalling that this insurer is doing this. But as you said, because our system is so divvied up and there's so much triangulation, like there's politicians and there's your employer and there's the insurance company and there's the hospital, it's like they had a convenient person to blame with their constituencies and their voters, but then they didn't have the responsibility to actually correct it or think about it in the right way. You know what I'm saying?
Mm-hmm. I don't ever blame Americans for being confused by our health system. I'm a health reporter who's covered this for a while, and I'm often confused. There are so many different players. There are all kinds of policies and restrictions. The federal government might announce a policy that a private health insurance company does not follow, so there's a difference between what some patients are getting and others don't get. At the same time, there can be a lot of speechifying around whatever is in the news and lack of political will to attack the underlying problems in our health system, which to me, as a longtime reporter, are one, we have incented some of the wrong things. We focus way too much on intervention and not enough on prevention. And two, we have not done a good enough job of helping the most vulnerable Americans get access to some of the things that the wealthier Americans can through our better health plans, through our better hospitals. At the top of the pyramid in America, our health system is great. That is the thing that people around the world know, and that's why they come to the Mayo Clinic and the Cleveland Clinic, because we can offer the best procedures for the best paid patients. But there are a lot of people who are missing out on that, and part of the reason they're missing out on that is because American healthcare is just so much more expensive, and it is not a right here. So folks often do without.
Yeah. Reading your reporting, you cited this Gallup poll number that came out just last week that actually surprised me. It found that Americans now have the lowest ever views of the U.S. health system. In the 24 years Gallup has been doing this poll, just 28% of respondents rate the quality of health coverage as excellent or good. And I guess despite everything, this surprised me because we literally just tried to fix the healthcare system in this country. It really wasn't that long ago that the Affordable Care Act was being passed and it was being hailed as a success. And I think certainly fewer people are uninsured. But it didn't this number does not reflect that.
The ACA did succeed at a few things. It lowered the number of Americans who are uninsured. We now have a record low uninsured rate. It did also appear to freeze some of the cost growth in America. If you look at the climb in healthcare spending, which was something that the ACA was trying to turn around, you heard a lot of people saying we need to bend the cost curve 15 years ago when they were negotiating the ACA. It's true that the cost of healthcare in America as a percentage of overall spending has basically flatlined. So that is in some ways a victory. But what we're increasingly seeing, Mary, is that coverage is not the same as care. You can have a health plan, but the health plan denies you what you think you need or what your doctors think you need. You can have prescriptions for medication, and the medication is just too costly for you. So those are some of the things that remain very big problems. And the idea that Americans' health overall has lagged behind other countries is something that we just see too. There are deep issues with the American health system that I think did find their way into this most recent election. Beyond UnitedHealthcare, I've been covering the selection of Robert F. Kennedy Jr. as Donald Trump's potential next health secretary. There are people I talked to who said they held their nose to vote for Donald Trump because they liked what RFK Jr. was saying about attacking these problems in the American health system. that is something that I think is bipartisan, that is very deep, and that Americans increasingly are attuned to, that we are getting sicker and dying earlier than our peers abroad, and there's a need to address that.
At one point, you, in your reporting, quoted a healthcare industry analyst who told you, I think the leaders of the industry need to look at what happened with Brian Thompson and ask, why does everybody hate us so much that when one of us gets killed in an assassination, we're not hearing sympathy from the general public, we're hearing scorn? And I'm wondering, what do you think it would take to have that deeper conversation?
I have been thinking a lot about that quote from Matthew Holt, a guy who's been covering healthcare, writing about it, thinking about it for many more years than me. And it's struck me, Mary, that as I've written these stories about UnitedHealthcare, I keep hearing from people in the industry who say, the average American doesn't get it. We're doing the best we can. The blame is misplaced. You would think that this outpouring and the death of a prominent industry leader would cause that reflection. In some corners it has, in many corners it hasn't. So I don't know what would change the thinking here. I think if there was some form of national organizing, taking it from social media and people writing posts that can be kind of cast aside and ignored, a post that might be over the top about we want these executives to die, but channeling that into productive organizing of look at all of these ways that Americans have been harmed by whatever policy or procedure and putting a spotlight on that, having congressional hearings on that, having news coverage of that, that is a lot harder to ignore. That starts to hit home. And then when the executives are hauled to Congress and forced to answer questions, they do have to grapple with it, often in public. So that, I guess, is what has not happened on a large scale. And sometimes because the lawmakers who are charged with overseeing the industry don't seem all that interested in forcing the executives to confront these tough questions.
Dan Diamond, I'm always grateful for your time and your reporting. Thanks for coming on the show.
Thanks for bringing me back, Mary.
Dan Diamond is a national healthcare reporter for The Washington Post. And that's our show. What Next is produced by Paige Osburn, Elena Schwartz, Rob Gunther, Anna Phillips, and Madeline Ducharme. We are led by Alicia Montgomery. Ben Richmond is the Senior Director of Podcast Operations here at Slate. And I'm Mary Harris. You can go track me down on Blue Sky. Say hi. I'm at Mary Harris. Thanks for listening. Catch you back here next time.
Every day when you log into ChumbaCasino.com, the ultimate online social casino, you get a free daily bonus. Imagine if you got daily bonuses in other parts of your life.
I chose French fries over loaded French fries.
I asked Stuart from accounting about his weekend, even though I don't care.
I updated my operating system without having to call tech support.
Collect your free daily bonus at ChumbaCasino.com now. And live the Chumba life. VGW Group. No purchase necessary. Void where prohibited by law. See terms and conditions. 18+.